coolest thing, curing patients of their cancer. My name's Marium and I'm a radiotherapy physicist and I work in the NHS. So a normal working day for me can vary on a day-by-day, weekly basis. The first day I could be doing something like treatment planning, so that's kind of deciding how a patient gets their treatment. So a clinician would draw on a contour, so that's essentially the cancer, and then it would be my decision to say, right, where do we want the radiation to come in from? On another day I could be doing quality control checks on a linear accelerator, and it's a very high energy X-ray treatment machine, and it's about 5.5 tons worth of weight, and it rotates around the patient and targets cancer. So I wanted to become a radiotherapy physicist after I did my MSc in medical physics. I did a module in radiotherapy physics and it kind of piqued my interest, and then after that, when I did the clinical science training scheme, I did a 6-month placement in it, and I just absolutely enjoyed everything that I did in the placement. So from there on I was like, right, that's what I want to do, that's what I'm going to be when I'm grown up. I think one thing that people don't know about physics as a science in general, there are a lot more women now involved, especially in radiotherapy physics. And I think that's a testament to the subject itself, that women want to, participate and have careers in science, and especially in physics, because it's traditionally a male-orientated field. But actually in radiotherapy physics, especially in my department, we're predominantly women, and I think that's quite a good thing to say about science. As a clinical department, we are very, very busy. So everything that we have to do, it fits around the patient's schedule. So quite often we do have to do early morning starts or late finishes. The other thing as physicists we have to do is that we have to liaise with a large number of non-scientist groups. So we liaise with doctors, with radiographers, who are the people who do the actual treatment delivery on the linear accelerators, and with engineers as well. So we have to work side by side with quite a large number of groups. Everything we do is a joint effort. You can't kind of wander off on your own and just get everything done by yourself. We work as a team. Do work experience. If you want to consider a career in medical physics, I think that's really important. It will give you a flavour for what we as physicists do. It will expose you to some of the things that you wouldn't necessarily know about, and it will tell you whether or not you have an interest in the field. You've got radiotherapy, you've got nuclear medicine, you've got PET. It's just the variety is crazy in medical physics. So I'd like to think we're curing patients of their cancer, giving them the best treatment that they can get. And I think it's quite rewarding when you've gone up to one of the machines and there's a box of chocolates, and it's from our patients that are very grateful that we've helped look after them for 7 weeks, and that just makes it all the more worth what you're doing. It's why you come to work.